This segment of Bridge Street is sponsored by CNY Cosmetic and Reconstructive Surgery.
If you're looking for ways to enhance your look, then CNY Cosmetic and Reconstructive Surgery can definitely help you. And guess what? They have been open since COVID-19.
That's right, but obviously operating a little bit differently than usual. Here to tell us about some of their new procedures to help keep patients safe are doctors Gregory Baum and Anthony Deboni. Good morning.
Hello. Good morning.
Thanks so much for joining us. And Dr. Deboni, let's start with you because you have been operating as an essential business since the beginning of this pandemic. So how has, business changed for you all?
Well, as with most businesses, we were on a level of shutdown once the order from the governor came. So essentially from the end of March until the first week in May, Dr. Baum and I were just operating, seeing only essential patients. So that means skin cancer, breast cancer, any acute problems such as lacerations, infections, and any of our existing patients that may have acute problems. But we were limited to just essential patients.
And Dr. Baum, now that, we're starting to open back up, Onondaga County is slowly opening back up. You guys are slowly able to do more procedures. So tell us about what you can help people with right now.
Well, we're basically open for all the procedures that we were open for before the COVID-19 crisis hit. It's just that when they opened up, they said for some elective procedures, and we were like, well, which elective procedures is that? And it turns out that it's elective outpatient procedures only, the 23-hour stay or less, which encompasses probably 98% of what Dr. Deboni and I do. So we're back to doing all the cosmetic procedures, both in the surgery center and hospital, as well as here in the office, the Botox, the fillers, the small areas of liposuction we can do in the office, eyelids, some laser procedures, all those cosmetic things that we can do, but also the insurance related things such as breast reductions and scar revisions and things like that.
Well, you know what? I feel like we need to give you a round of applause.
Yeah.
Because we have been waiting months, 2 months now. Looking a little crazy, but we're going to get back. We're going to get our looks back. No, but now how are you keeping us safe? So, because we still have to practice social distancing and wearing masks. So what are your offices doing to make sure that we're staying safe when we come in to see you?
Well, we're operating under the guidelines of both the county executive, the governor, as well as our own Society for Plastic Surgery, and they've set out some pretty clear guidelines on how we are to operate in order to maximize patient safety, which is obviously our primary goal. So, obviously all the people in our office as well as patients are required to wear masks. When we're providing any treatments, we're wearing, essentially full personal protective equipment. There, meaning N95 masks if we're doing any injections or anything, surgical, particularly around the face, eye shields, and certainly gowns if needed for the degree of the procedure that we're doing. And patients, obviously, as well as employees, are all being screened before they come into the office with temperature and a questionnaire. And if anybody has anything that would indicate potential COVID exposure, then obviously they're redirected and they're not seen, and they're directed to the appropriate testing or their primary care physician.
Dr. Baum, I've heard a lot of people say, through this whole thing, as Tanisha mentioned, they're so excited that they can get back and get their Botox. So for those people, are you seeing a lot of people sort of coming in? Are they taking this like, okay, I can do this now? And are you seeing a lot more patients?
The doors are busting down, to be honest with you. Dr. Deboni and I have been inundated, along with our PAs, for the non-invasive stuff, the Botox, the fillers, those kinds of things. Yeah. Because people they've been waiting, and our hands literally have been tied by the American Society of Plastic Surgeons and the directives coming from Albany, from Governor Cuomo and the Department of Health. So now that those things are over, people want their Botox, I can tell you that. They want their hair salon to be open, and they want their Botox.
Yeah, we've heard all about it.
Yes, yes.
All about it.
Listen, thank you so much, gentlemen, doctors, for joining us this morning. We appreciate it. Glad that you are back open.
Thanks so much.
Thank you so much.
You're welcome. And we want to remind you that CNY Cosmetic and Reconstructive Surgery is located at 5898 Bridge Street in East Syracuse, right near our studios here at News Channel 9. And to learn more about how they might be able to help you, you can call 315-663-0112 or connect with them on social media. You can also visit them online, plasticsurgeryofsyracuse.com.